Did you know that there's a virus that's infected almost everyone watching this video right now? It's not COVID, it's not the flu, it's a virus called Human Metapneumovirus, short HMPV. And right now it's making headlines in China and around the world. HMPV has been flying under the radar for years until it made the recent headlines. A rare new virus, you might ask? In this video, we'll explore everything you need to know about HMPV, what this virus is, how it spreads, and what you can do to protect yourself, and whether we're looking at another potential pandemic. Alright, so right off the bat, here are 3 things you need to know about HMPV. HMPV is a respiratory virus similar to the common cold, but it can cause more serious illness in vulnerable people, including young children, older adults, and people with weakened immune systems. Right now, cases are spiking in parts of the world, like in China, but most health experts say it's unlikely that HMPV will spark another pandemic. Regardless, there are simple steps that you and your loved ones can take to stay safe and healthy. So, let's break it all down. So what exactly is HMPV? Discovered in 2001, Human Metapneumovirus belongs to the family of Pneumoviridae, just like the respiratory syncytial virus RSV, which also made headlines in recent years due to an increased number in infections. HMPV is one of the many respiratory viruses that can cause symptoms like the common cold, and most of us will have had an infection with HMPV by the age of 5. You can get HMPV again, but symptoms are usually mild after your first infection, often without even realizing it. The symptoms of HMPV infection can look a lot like other respiratory illnesses. They include cough, nasal congestion, sore throat, fever, and shortness of breath. Currently, there's no vaccine or specific antiviral treatment available for HMPV, but most people simply recover from an infection within a week or 2. However, especially young children and adults above the age of 65 and people with weakened immune systems are at a higher risk for severe illness, such as bronchitis and pneumonia, and therefore might need special attention. Just like SARS-CoV-2, the virus causing COVID-19, HMPV can spread through the air via respiratory droplets when an infected person coughs or sneezes. But HMPV can also be transmitted through contact with surfaces contaminated with the virus. For instance, think of things like phones, door handles, and toys. So here's how you can protect yourself. Wash your hands often with soap and water. Avoid close contact with people who have respiratory symptoms, and cover your mouth and nose when you cough or sneeze. Stay home if you're feeling sick. I will add some useful links for more details on prevention and treatment for you in the video description. Recently, there's been a surge in respiratory infections in China, including but not only HMPV. This has raised concerns about a potential new pandemic. But here's the good news. Health authorities like the World Health Organization and the European Centre for Disease Prevention and Control, ECDC, have stated that the rise aligns with seasonal patterns that are usually observed during this time of the year. Reports of overwhelmed hospitals in China have not been confirmed by Chinese officials, reports the WHO, and they say that they will closely monitor the situation. The bottom line is that at this stage there is no evidence that suggests that HMPV poses a pandemic threat. What do you think? Let me know in the comments. So should you be worried? While it's always good to stay informed, there's no reason to panic right now. HMPV has been around for decades and most of us already have some level of immunity. Most experts say that the current rise in cases is consistent with typical seasonal trend and healthcare systems are managing the situation effectively. Of course, we will also follow the situation closely and keep you updated should there be changes. If you want to understand more about life science and stay informed about current health developments, join our community. We break down complex medical and scientific topics into clear, accurate explanations backed by current research. So if you want to stay updated and never miss a new video, please consider subscribing to the channel. Thank you so much for watching, and remember, stay informed, practice good hygiene, and take care of yourself and your loved ones. Bye.